Hello everyone, I am Dr. Krithishree. I have done my Masters in Psychiatry with a degree of MD Psychiatry and I am working as Consultant Psychiatrist in KMC Hospital, Mangalore. Yes, it is very difficult to diagnose adult ADHD because if the person is not aware of the symptoms, then he will not come for help and it goes unnoticed. The signs to identify adult ADHD are broadly categorized into inattentive, hyperactive and impulsive set of symptoms. Coming to inattentive, a person known to make careless mistakes. They show a lot of procrastinations in completing their activities. They lose things easily, like losing their keychains, wallets, earpods, and so on. They struggle to sustain their attention. Also, they are known to avoid mentally draining activities. Coming to hyperactivity, they are mostly like they appear fidgety. But here the hyperactivity is not very obvious because as much as possible they try to suppress it. Though there is internally the person would be feeling like a motor running inside them, they will mostly like show symptoms like moving, changing their position, tapping their legs, excessively talking and so on. Coming to impulsivity, they show risky behaviors, blurt out their thoughts without even thinking about the consequences, and also like known to show mood swings. Symptoms of ADHD in adults and children, they manifest differently because in children they are too jumpy, hyperactive and talkative. However, in adults their hyperactivity what we see in childhood ADHD is not commonly seen here because they are less overt and more conscious about the surroundings, because as they grow and become responsible, these hyperactive symptoms reduces. However, in children, they are more talkative, hyperactive, blurt out whatever comes to their mind and they keep running around. In the diagnosis of adult ADHD, self-awareness becomes a very important factor because during their childhood days, only if it is severe form of ADHD, it comes under the radar of diagnosis and evaluation. However, as far as the child is doing well in studies, which we see mostly in moderate or mild cases of ADHD, it never comes under the observation of the caregivers or the teachers. So having self-awareness about these symptoms can bring the patient for detailed evaluation and further management. No, non-pharmacological methods like psychotherapeutic techniques or lifestyle changes can help in managing adult ADHD cases. However, in case of severe symptoms, medications are required. Coming to psychotherapeutic techniques, CBT techniques help in procrastination and organization skills. Other techniques like mindfulness and dialectical behavior therapy helps in emotional regulation. Coming to lifestyle changes, exercises are known to increase the dopamine release, hence reduces impulsivity. It is very important for patients with ADHD to have a fixed sleep routine. Then having a nutritious food, diet rich in omega-3 fatty acids are also known to be beneficial in such individuals. Having a structured routine can help in organizing their timetable and having a routine to themselves. Research has shown that personalized coaching techniques like Pomodoro technique is found to be useful. In Pomodoro technique, 25 minutes of continuous sustained attention demanding work followed by a short burst of break is given. This helps in improving the focus as well as reducing the overwhelming emotions. Coming to habit building strategies like exercises, exposure to bright sunlight in the daytime, balanced diet, that is the diet rich in omega-3 fatty acids, visual timers advisable. Through this, it helps in increasing the release of dopamines and hence making the time tangible for them.